Everyone wants to get home as soon as possible after they've had an operation. Women having hysterectomies at Birmingham Women's Hospital are now able to go home on average in just 3 days instead of the usual 5. It's called enhanced recovery.
We are aiming in our hospital, which does between 300 to 500 hysterectomies a year, to reduce the length of stay to 2 to 3 days.
We want to make sure the patient has a happy journey from the time of referral, from the time they're in hospital, right up until the time they're going home and beyond.
An enhanced recovery programme is welcomed by lots of women who come in who are very conscious that they have to get back to work or get back to their normal self.
A small part of it is to reduce hospital stay, but really a bigger part of it is to enhance their recovery afterwards as well. So trying to get women back to their normal lives as quickly as possible.
We can actually get them to mobilise quickly, to eat and drink quickly, soon after their operation, and that earlier recovery leads them to have a much quicker long-term recovery.
Patients' psychological preparation starts well before the operation itself. At every stage of their journey, patients are given information about the hysterectomy procedure and the steps they can take to improve their recovery.
I remember my sister having done donkeys years ago. It was about 2 weeks, I think.
That she was in hospital?
Yeah.
Things have changed quite a lot, and we now know that people don't need to stay in hospital for that long. And usually we get you up and about by the first day.
I'm just surprised it's such a short time.
It's a multidisciplinary approach, giving the right information and encouragement to the patient at every stage.
The important thing is to sort of dispel a lot of the myths that people might come in with. The preparation in terms of pre-op, by equipping people with the information that they need. Their expectations on the other side of things are a little bit more positive, and they get back to normal, from my experience, much more quickly.
Janesh Gupta and his team have developed improvements to their surgical techniques, helping to reduce the length of the operation and minimise post-operative complications.
So we're now closing. I think she'll be pleased with that.
After the operation, effective pain relief means that patients can get up and about sooner.
Patients can recover quicker because they're in less pain after their operation. And I think that early mobilisation has made a big difference.
We'll be following 2 women through the enhanced recovery programme, from their hysterectomies and through into their recovery period. Carmen, who's 42, and Fiona, who's 30. The first step in the process is a clinic appointment with a gynecological team.
Hi Fiona, coming in, have a seat. Patients get referred from the general practitioner and we see them in clinic usually within a 5-week time period. Within 12 hours I'd expect you to eat and drink. You're able to walk about as quickly as possible. That would mean that the long-term recovery is much quicker as well. So I'm expecting you to get back to your normal self within 3 to 4 weeks after the operation. Okay?
Thank you.
Good.
Thank you.
We then get them into a clinic for pre-operative counselling and assessment, which is really to cover them for the fitness to surgery, for anaesthetic reasons, their blood count for haemoglobin reasons, and generally if they're fit and healthy to undergo a major operation.
Following your surgery, I just wanted to talk to you a little bit about your recovery. Most people go home round about day 2 to 3.
Hi Fiona, you all right? My name's Emily, I'll be one of the nurses looking after you today. All right, I'm just going to draw the curtains.
A few weeks later, and it's the day of the operation. Fiona and Carmen both arrive at hospital early in the morning, ready for their hysterectomies later in the day.
Mobility is a real key thing in, quickening your recovery, really. The quicker we do it, the better long-term, really, the outcome's going to be.
This morning they've told me 3 to 4 weeks recovery time. That'd be amazing if it really is true.
Hi Fiona.
Hi, you're right.
How are you?
All right.
You okay? You're set for the operation then today?
Yes.
I'm just here today to have the hysterectomy because it's just the best option, really. The pain's getting a lot worse and my eating habits are getting terrible. It just absolutely kills me and it knocks me off my feet, really, to be honest. I can't eat curries or spicy foods or anything, so I'm just looking forward to having a nice spicy curry.
When you have the eating and drinking early, it means that you're able to get back to your normal self much quicker.
Sure.
Okay.
Okay. I think the standard procedure is like 6 to 8 weeks, but then they're trying to get me up and about within like the 3 to 4 weeks, which hopefully it'll work. It did surprise me a little bit when they first said it, and I was a bit like, 4 weeks. But if I'm feeling okay, I'll be well happy to get up within the 4 weeks and back to work.
No, I'm not the type of person to stop in bed. It's going to be a miracle for me to sit still as it is.
Carmen, how are you?
So, the quicker the recovery, the better for me. I really want to get recovered really quick and get doing back to me normal life.
Fiona is the first to go to theatre. Her operation takes around an hour.
Fiona's hysterectomy has been relatively straightforward, and hopefully she should get a very good outcome from it. She's just literally come out of theatre and she's in recovery, and the next stage will be for her to go down to the ward where she will basically recover overnight. It's going to basically be down to her now from her motivation point of view.
As the anaesthetic wears off, patients may still feel sleepy, but as the pain is being controlled, it's not long before their recovery can begin.
Yeah.
Whilst Fiona is recovering, Carmen is taken to theatre for her operation.
Carmen had a hysterectomy through her abdomen. It was all straightforward, so I'm hoping that she'll have a good recovery. I would expect that she'll be up and about tomorrow, and I'm hoping that she can go home on day 2 or 3.
The efficiency and techniques of the surgery that Professor Gupta and his team have developed will help to make Fiona and Carmen's recovery as quick and pain-free as possible. It's early morning on the first day following surgery, and the patient's recovery is going to plan.
Fiona is now 19 hours post-surgery. She started drinking approximately 4 hours after surgery and has been drinking well throughout the night. She's just had tea and toast for her breakfast. Carmen is 12 hours post-surgery. She started to drink reasonably well.
I've just been in to see her, and I'm pleased to say that she's looking very well. She's now eating and she's been stable overnight, so all as planned at the moment.
A few hours later, Carmen and Fiona's drips and catheters have been removed, and all is going well.
It's lunchtime on the first day of recovery. Carmen managed a small amount at breakfast, and we've just sat her out in the chair, and she's managed a little bit of food for lunchtime as well. Fiona has done really well as well. She had a couple of slices of toast for breakfast, and we've also sat her out to have something for lunch as well.
I'm starving. Even though I've eaten this, I'm still hungry. I just feel a bit tired really, and just a bit uncomfortable. Other than that, it's not nowhere near as bad as I expected. Just glad to get some food, really.
The more mobile they are and the more they're managing to tolerate food, the quicker we find they recover.
It's a matter of now getting them mobilised and back on track for the early part of their recovery.
It's the start of day 2, and both Fiona and Carmen are up and about.
Fiona has just walked down to the day room and she's going to have breakfast. She's actually done very well over the last 2 days. She's done exactly what we would have expected her to do. She's been mobilising reasonably well yesterday, eating, drinking. This early recovery and early mobilisation will be crucial for her long-term recovery. So that's a good sign that she should be able to be discharged home tomorrow.
I've just been in to see Carmen. She's doing very well. She's now eating and drinking. She's been up and out of her bed this morning herself. She is at the stage where I would expect her to be now. I think that she will be able to go home tomorrow, which will be day 3 after her operation.
By the evening of day 2, Fiona has gone home.
That's a good aspect of her being discharged on day 2, because once she gets home, she'll be able to mobilise much better in her own home environment, and potentially recovery should be a lot faster for her, because that's actually the key component to try and avoid the ongoing issues of discomfort with pain and eating and drinking.
By the beginning of day 3, Carmen's also ready to go home.
Good morning, Carmen. How are you?
I'm fine, thank you.
Do you feel ready to go home?
Yeah, I feel more comfortable at home, I think.
Good. Fine. I'm happy for you to go home. Carmen's doing very well. I've discharged her this morning. She feels ready to go home in herself. In fact, she might have been able to go home yesterday evening, but we kept her in overnight just to make sure that she was okay. The week that she goes home, she might find that she's quite tired still, so what we usually say is potter her around, even things like you know, making herself a cup of tea, going up and down the stairs. She might need to rest afterwards, and that's completely normal. I would have thought really by about week 2 and 3 she'll be able to do most things around the house and be able to go out for short walks and things, and by about week 4 I would have thought she'd be back to normal.
Once they're discharged, it then depends primarily on what information they've been given that dictates how long they're going to take to recover. This can be influenced by several factors: general practitioners, friends, relatives who've undergone similar operations. So all of these are going to be then the main influencing factors for patients to then use as their recovery time period.
It's exactly 3 weeks later. Having followed Professor Gupta's advice, Fiona is recovering well.
Generally, I'm feeling really good, you know. I am feeling really good.
From the operation to full recovery should be between 3 to 4 weeks. Remember, the traditional viewpoint is that I'm going to be at least, 6 weeks, if not 3 months, debilitated and unable to do things.
I haven't let the hysterectomy slow me down, really, at all. I've been doing a lot of shopping, and I've been out for a lot of meals as well. Last week I went to a theme park. Lovely weather, had a lovely picnic, and decorating my front room. No wallpaper, no curtains, no carpet. It's really good.
Patients have to put in quite a bit of effort for themselves and be motivated to want to mobilise and get themselves up and about quickly. We've already shown that highly motivated patients will do better than those who are not motivated.
So many people were saying, you're not allowed, you can't go out, you can't carry anything, you're not going to be able to walk anywhere, you've got to take it easy, no exercises. So I generally thought I'd be bedridden, but I've been very surprised at what I've been able to do.
Do you need any help with your packing?
No, I'll be all right, thank you. I really am 100% glad I've had it done, and the recovery has been a lot easier than I ever expected. It's been 10 times better than I thought.
Carmen is also well on the road to recovery.
At first I was really tired and sore, but as the weeks are going by, it's getting better. But I'm not the type of person that I can sit still, to be honest. I have to get about. Even if it's just walking around the house, I have to walk around. If nobody's been here, I've potted about and done stuff. But if somebody's like that, I will do it, but I'd rather do it myself.
Although a hysterectomy seems like a daunting experience, for the majority of patients, the Enhanced Recovery Programme makes a huge difference to how quickly they can get back to normal life.
The clinical side, the surgical side, has changed. The surgical techniques have changed, but the most important factor for long-term recovery is then down to the patient herself.
A lot of people tend to compare themselves to friends. My friend had a hysterectomy, she was terrible. She was in horrendous pain, when that isn't the case. For most people, having a hysterectomy shouldn't be such a big thing as it used to be.
Staying in bed, sitting around doing nothing, not only is it not good for what's going on inside, but for your mind as well. I just generally think it'd be a hell of a lot worse if I was sitting down doing nothing.
I am going in the right direction. I know it was a must. I did need to do it.
It's all about empowering patients. It's all about giving them the resources that they need to take control of their own health and their own recovery, and give them the confidence and the resources they need to get better quicker.